Union budget is around the corner. As always, demands are being made from various quarters to the finance minister. While the cut or hike in taxes dominates headlines and public discourse at the time of a budget, an area of significant importance continues to be neglected. I'm talking about healthcare financing. India's aspirations of being a global economic powerhouse are linked to the health of her people, and the government will need to think of innovative ways to address the healthcare challenge. Now, India is among the countries with the lowest share of government spending on health at a little over 1.2% of GDP. Compare that to China at 2.9% and 4.1% for Brazil. In 2013, the Planning Commission and now the Niti Aayog had revised the target downwards for government spending on healthcare from 2% of GDP to 1.87% of GDP. That's for the 12th plan ending March 2017. It would perhaps be unfair to say that nothing has happened in the past decade in this space. The UPA launched the National Rural Health Mission and the Rajiv Gandhi Swasthya Bima Yojana and did increase the allocation for healthcare spending. The Modi government has proposed making health a fundamental right under the National Health Assurance Mission to be rolled out in phases this year. Now, the government proposes to offer free medication, diagnostic treatment as well as insurance cover for serious illnesses to all by 2019 at an estimated cost of almost $11.5 billion annually. So given the government's fiscal constraints, will the health for all promise remain unrealized? How can the government incentivize and promote private sector participation in delivery and financing of healthcare? And is a health cess warranted? And finally, what are the imperatives to address the many challenges the healthcare sector faces? Joining me to discuss all of this and more, Nachiket Moore, former banker who spent his time on several government committees looking at universal health coverage. Also with us, Sujata Rao, the former health secretary and founding board member of the Public Health Foundation of India. With us, Dr. Somil Nagpal, a health specialist with the World Bank. Appreciate you joining us here. Mr. Moore, let me start by asking you about whether or not the health cess is a good idea to start with. As I said, we're just about to see Budget 2015 being unveiled. We know that this was an idea or a proposal that the Health Ministry was going to put forward to the government. Do you believe that this is warranted at this stage?
My sense is that a generalized increase in taxation, which health cess is also, is something that has to be examined as a part of our overall tax collection strategy.
Yeah.
Will it mean more people concealing income? Will it mean more people trying to find a way to avoid paying taxes? Clear challenge is whatever tax pool is there, how can the government decide to allocate more money? It can increase the tax pool by raising taxes, of which health cess is just one name. But the issue is, how do we get more money allocated to health?
So, if I were to ask you to vote yes or no for a health cess?
I would say no.
No. Sujata Rao, yes or no for a health cess?
No.
No. A very confident Sujata Rao saying no. Dr. Nagpal, are you on their team or are you on a different team?
So I would probably take a neutral position on that. I think it's not important that there is a health cess and maybe a no is the right answer. What's important is how do we prioritize what we already have or what we are going to add to our resource base in the coming year.
But at this point in time, do you believe that this sector is going to get any more attention than it previously had?
In terms of allocation of funds, unlikely.
Because of the fiscal constraints that the government is faced with.
Fiscal constraints, also there has to be some clarity as to what else will you not do. Because if you're going to do everything that was done earlier, where is the money going to come from?
So what happens then to the National Health Assurance Mission and the fundamental right of health to all?
No, clearly we need to answer the question of where are the funds going to come from. If it's going to come from increased taxation, which I am assuming means increased allocation, that's good. Or other mechanisms by which the government can play a role. I mean, clearly health is not quite the same as building roads. It is not in the classic sense a public good. What the government can play a role is organize things better, is think about other mechanisms that it can use even to direct funding better.
Sujata Rao, let me ask you, because just before we started this show, you said you're angry about the state of healthcare and the state of healthcare financing in this country, and that you believe that precious little has actually been done to address the challenges facing the sector.
I think so, and I have a couple of points following up. One is whether it's a 9% rate of growth, which we saw in 2007 for 3 years, or whether it was the Hindu rate of growth that we had before. The expenditures on health have always been a steady 1% of the GDP. In terms of revenue expenditures, it's never crossed more than 3 to 4, 5%. So the point here is, I'm angry because I don't think it's a question of lack of money or competing demands on the money. No, I think it's really a lack of political commitment. We just don't care enough about health, and we don't care enough about education. Why I said no to the health cess is that, you just think you put a health cess, you collect some 9,000-10,000 crores and you think that's there and we've done our job. But here it has to be looked at in the more macroeconomic point of view. 70% of the public spending has to come from states. And of that, again, 70 to 80% has to be mobilized in the northern states where the disease burden and the crisis is much more. So what's their fiscal capacity? What is the central government? So the whole structure of financing, public financing itself, I believe, have to undergo a change, and the money has to be found.
It's a good point that you're making. Dr. Nagpal, let me address that issue. It's not just about the money. It is about getting our priorities right. Does it give you confidence that the government is now talking about a new national health mission? The government is talking about a new policy for 2015, which will hopefully articulate what this government's intentions are, at least over the next 5 years as far as the sector is concerned. What gives you hope at this point in time?
The first thing that gives me hope is that when we had a good rate of economic growth in the last decade, we did invest in some very prominent programs, the National Health Mission, the RSBY, many state programs, the Vajpayee Arogya Shri, the Rajiv Arogya Shri. All these programs together have meant that now what you're talking about is 30% of the total health expenditure at 1.2% of GDP. It was earlier about 24%, just a decade back. So we've actually upped the NT and reduced out-of-pocket expenditures from what used to be about 69% to now about 59% in a space of a decade. And that's not a bad decline if you see.
Which is what I pointed out by saying at the start of the show, that it would be unfair to say that nothing is changed or nothing is moved.
The second thing which I would want to say on this is that we would focus a lot on whatever incremental value we can get in terms of money. We would focus on getting the maximum value in terms of health out of that money. Looking at the best buys, hopefully doing very systematic priority setting, prioritizing that rupee which gives me more health outcomes before I do something else.
And this is where I would say, when you begin to prioritize and you realize, like he has said, he doesn't expect much more money available for health, and when it's limited, scarce resources, and you have to strictly prioritize, then I think we need to ask ourselves, what is the state's basic ethical responsibility to its citizens? How do we accept the fact that a large number of the states like Orissa, Bihar, UP, Jharkhand have people without piped water supply, less than 10% of the households in rural areas? And there is, we have 4 lakh children under 5 dying of diarrhea and environmental reasons. These are not acceptable figures. So what worries me on this whole national health assurance or universal health coverage is that, we immediately gets translated to providing insurance cover for a cardiac or a cancer. Of course, ethically, I also agree that that's what is the ideal condition. But when does safe water, sanitation, these are public goods. And that's the basic responsibility of the state.